So the first person who I'd like to introduce is one of my favourite individuals at Bendigo Health, and a person that I've had the pleasure and privilege working in not only the capacity of my role here at the Carer Gateway, but also over the years at Bendigo Health. She's a real tireless advocate for ensuring that individuals and Victorians are supported to achieve good health outcomes, and that very much extends to carers across the state. I'd like to introduce Tassia, Michaleas, the CEO of Bendigo Health, and she's going to be talking about some of the key achievements attached to the Gateway and about some of the key individuals and organisations that have been contributing to that journey along the way. Tassia, great you're here, and over to you.
Thank you, Evan, and it's a very generous introduction. It is fantastic to be here this morning and to celebrate this momentous occasion. I would, like to personally welcome you all today, including our guests from the Commonwealth and the Victorian governments. I'd like to begin by acknowledging the traditional owners of the various lands on which we are all meeting and pay my respects to elders past, present and emerging. And I would like to thank them for the generosity of the sharing of this land and culture. I'd like to acknowledge the essential funding that both the Commonwealth and the Victorian governments provide for carer services. Without this support, the health and well-being of many carers would be compromised. I'd also like to welcome our guests from Tandem, Carers Victoria and Anecto, and to Kellie King for sharing her experiences as a carer today. Also, our panellists from each of our Carer Gateway partners: Melanie Hill, Raj Taneja, Jennifer Polley, Rob Gargano, Katie Millen, Nilo Banai, and Mick Leyden from Merri Health. I would also like to extend a very warm welcome to all of the staff from our 7 Carer Gateway partners across Victoria. These being Alfred Health, Ballarat Health, Barwon Health, Bendigo Health, Family Care, Uniting VicTas, and Merri Health. Quite a few health services there, bit of a mouthful to say. So thank you to our partners for your work, your commitment, your skill, and the positive impact that you have made supporting carers over the past year. We are extremely privileged and proud to be leading this work and to be working with all of you. We actually couldn't do it in isolation. It is a true partnership on the ground. So just over 12 months ago, we launched this partnership to provide the Carer Gateway service in Victoria. The Carer Gateway is the most significant reform to Australian carer services in more than a decade. The statewide program, as most people would be aware, offers support to Victoria's nearly 750,000 unpaid carers, those everyday heroes who care for someone who needs extra support and assistance, either due to disability, age, mental illness, or long-term physical illness. We know that unpaid caring is relentless. It can be emotionally, physically, and financially demanding work, which can take a toll on the health and well-being of carers, and that getting support early can make a big difference to a carer's life, and that's what we're here to do. Launching a new multifaceted statewide program was always going to be a big feat, and we did not have rose-coloured glasses about that. We knew it was going to be tough. However, we launched during COVID, which we didn't expect, the worst global health crisis in our living history. One that has and continues, as Evan indicated, to affect us all in the way that we work and live, particularly here in Victoria. We've had a very unique experience to the rest of the country. It's taken a huge toll, and unfortunately, only if you're in it could you understand that. So that toll deeply impacted carers. It increased their isolation, and at the same time, It took away the regular activities and supports that they were used to and accustomed to, which supports them to be better carers and to undertake their role. Together with our health partners, though, we have achieved a lot. I'm so proud of the support the Carer Gateway has given and the positive impact we have made over the past year. When the pandemic hit, we made the most of the flexibility we were given to deliver services. And we thought creatively, changing the supports we delivered to meet the acute needs of the carers as determined by them. We scaled up counselling services as demand increased for that service. And across the last year, outside of counselling, coaching, peer support and respite, we've provided tailored packages that have included things like laptops and software to help carers develop their skills and training. And more importantly, to stay connected and engaged at a time when Victoria adhered to the most stringent lockdowns to ensure our safety in the world. What makes the Carer Gateway work so well in Victoria? People might ask. Well, I think it's our big team approach. Whether you're in Moreland or in Mildura, we are all operating the same processes and practices. You only have to make one phone call to one central number and tell your story once. You don't have to repeat it. That's really important. And we know that. We know that it can be draining to have to say what you need multiple times until you're heard. You know, one phone call, one number, you're heard, you're understood, you're supported. Of course, it hasn't been easy. There have been challenges and hurdles along the way, and there will continue to be. But together, we can overcome them. We're very confident about that. One of the biggest challenges has been pivoting to meet the needs due to COVID. As you can imagine, not only were we supporting clients, but we were also supporting our staff. And that toll needs to be factored in across the whole sector. But I'm pleased to say we've done this and the carers have received the services that they need, that they require. A reflection is of the growing need and increasing awareness and confidence of the Carer Gateway is that people, new and existing, continue to access the program. And those numbers are increasing every day. And the feedback is absolutely fantastic and positive. We will continue to listen to that feedback and continue to work within the flexibility of the program to respond to what carers need in order to ensure we are providing the best service possible. So we have just ticked over 1 year of the program, the first milestone in our long-term commitment to improving support for carers. We've achieved a lot, we've learned a lot, as I've indicated. We have made changes and improvements along the way, and we will continue to do so. We're in this for the long run, and that's something we're very committed to. Now in our second year, what would that look like? Well, one of the key things is that we want to increase access and awareness. We want to reach another 20,000 carers. We want to move coaching from the pilot stage to one-on-one tailored advice for carers statewide, and we want to increase our marketing and resources. We want to also reach hard to reach communities. That's a funny word, reach hard to reach communities, but that's what we want to do. And those people from a non-English speaking background and people from the LGBTIQ backgrounds as well. We want to make the services accessible as possible and easy to reach, absolutely easy. So what can you do to help? Well, we want to raise the awareness. We want you to speak about the program, you be ambassadors for the program, you be champions, and talk about how people can come into the program really in a simple way. So I want to thank you all once again for joining us today to celebrating the first anniversary of the Carer Gateway and to explore how we can best care for carers during COVID and beyond. We are in COVID now, but there is a beyond. We need to be confident about that too. I look forward to the lively discussion that's going to occur. But firstly, before I close, I would like to thank a number of individuals who have worked tirelessly to bring this program to fruition, both within Merri and our partners, but also at the Commonwealth level. I want to acknowledge the Commonwealth funding for this program and the continued support and faith they have shown in Merri. I won't name people as I fear I will miss somebody really important that isn't a good thing to do. But I want to acknowledge the true co-design and partnership that has and continues to occur to ensure that the program is responsive to carer needs. In concluding, I would also like to thank Minister Ruston, who unfortunately couldn't be with us live today due to other commitments, but has taken the time to record a message for us to share with everyone. Please join me now in viewing this message.
To Tassia and Michaleas at Bendigo Health and to everybody celebrating with you today, thank you so much for the opportunity to celebrate this really important milestone. It's hard to believe the Carer Gateway service providers have been operating for a year now. What a time to look back at all the support you've been able to give carers who sacrificed so much to support their loved ones. By the end of last year, carers across Australia received more than 1 million hours of planned and emergency respite. By the end of March this year, more than 179,000 calls were made to the Carer Gateway. Carers face specific challenges, and it's excellent that the Carer Gateway is a place that carers can trust and know they can turn to for a wide range of supports. Whether it be counselling, coaching, peer support, emergency respite, the Carer Gateway can help improve wellbeing, reduce stress and build resilience. We know that getting a job is a game changer for anyone, and I'm so pleased to see so many carers also being able to transition back into the workforce or study thanks to the Carer Direct support packages. It's all part of the Morrison government's single biggest reform to carer support and services in more than a decade. A service delivery model designed by carers for carers to help them get the support they need early before reaching crisis point. Services span in-person, across the phone and online, implemented with a primary goal in mind to support the important work of our nation's 2.7 million unsung heroes. A nationwide system that draws on the expertise and passion of so many health and social support organisations to stand ready to support carers. At the height of the global pandemic, Merri Health, along with the 9 other Carer Gateway service providers, were in the midst of implementing these really important services. Despite the challenges, I'm pleased to say that from April to December last year, carers in Victoria were provided with access to more than 170,000 hours of planned and emergency respite. More than 7,800 carers across Victoria had registered with the Carer Gateway. Most impressively, Merri Health provided these services while being required to adapt service delivery to accommodate the physical isolation restrictions imposed at the time. Your unwavering commitment to supporting carers saw you extend your operating hours during the second Melbourne lockdown to provide that crucial ongoing support. For this and your continued contribution and commitment to carers, I extend my sincere thanks and acknowledge your hard work and sheer determination. Today is a wonderful opportunity to reflect on your achievements, continue to recognise the important work of Australia's carers and spread the message that we're here and ready to work with you to support our nation's carers. In closing, I'd like to take this opportunity to extend my gratitude to carers. Thank you for your dedication to supporting Australia's carers. Carers don't need to know what they're looking for, they just need to take the first step and be open to receiving the help that is available. All the best for today's celebrations, and once again, my sincere thanks.
Time has been a real challenge. I find it really hard sometimes to find a balance between me time and caring time. I think deep down in my core, I always knew that I was in a caring role, but there was also this pushback and resistance around wanting to identify as a carer. I just kind of embraced it, I guess. I just went from family member to, yes, I do need support, and yes, I can access support, and yes, life doesn't have to be so hard.
Often people come to us without knowing what support is available to them. They're battling through, doing the best they can, and we know that carers often put themselves last. And when they reach out, it's nice to be able to work with them, identify where they can have some support and live a normal life again.
The harder thing is to be there 24/7. At times it can get a bit exhausting. When you talk to somebody else who's a professional, they can give you more information about things. It can help you, it can broaden your mind and thinking.
The thing that the Carer Gateway does best is we really work with the needs of the individual carer, because all carers have such different needs and different circumstances.
For me specifically, it's being a carer to a young, very active 4.5-year-old boy.
So this is your first experience of being a carer?
Yes. Sorry. But yes. Obviously working from home, I had to conduct all my work as well as teach my other child, but as well as look after Andrew. And Uniting knew that they added an extra layer of pressure, so they got in contact with me and offered to engage some more supports and services to carry me through some certainly challenging periods.
It is hard sometimes to ask for help because carers tend to think, I don't need help, I don't need support. We eventually got NDIS for my son, and that wouldn't have happened if I hadn't got that support. And the positive changes is that now my son can go away, and I feel that's benefited us.
Carers are resilient. We are not trying to prop them up, we're trying to plug in some gaps.
The Carer Gateway is a Commonwealth funded program. The Carer Gateway provides a unique role. We are the gateway to supports for all carers. It's a one single entry point across Victoria, which makes it really easy for people to access the service.
The Carer Gateway can help with resources for financial support, it can help with counselling, it can help with managing your life, and that's what I found amazing.
I've been able to talk to people who understand, who have been able to give advice and be there knowing where to start, and that's literally picking up the phone, make the call because you've got nothing to lose.
I love that video so much. I really like the sense of movement that's there. We started off with the famous cows in Shepparton and made our way to the trams of metropolitan Melbourne with a brief detour to Ballarat and finished up down the Princess in Geelong, which is really symbolic of what we're talking and focusing on today in our session, caring for carers, COVID and beyond. Looking at the last 12 years of, not 12 years, my goodness, I don't know where, that would be a very different program. And I think perhaps we might be a little bit forlorn if it was 12 years. The last 12 months of operations and support through the Carer Gateway in Victoria. My name's Evan Wallace. I'm the Partnership Coordinator for Merri Health. And in that video, we also heard from a number of carers. And one thing that's always so important to remember and think about when looking at the carers that are supported through the gateway is the fact that it's so impossible to generalize and about the nature or background or experiences of carers. In that video alone, we had young carers, older carers, carers from different cultural backgrounds. And it's wonderful that we've been able to pull together a service that meets the needs of individuals of different ages, of different backgrounds. And as Tassia mentioned in her speech, it's very much an aim of ours to keep improving, building upon that and ensuring that the gateway is accessible to different communities over the next 12 months of Carer Gateway operations. It's so important in times like this to not only hear from providers and organisations that are delivering supports, but also from the individuals who are receiving assistance and who can tell us about their experiences through the Carer Gateway. That's why it's a great pleasure to introduce Kellie King. Kellie is a carer of multiple care recipients. She has a daughter with an acquired brain injury, and she's the full-time and sole carer for her grandson who lives with autism, and is also the sole carer for her aging parents, one who lives with dementia and the other who suffers from chronic health problems. She's worked in the carer space for the past 15 years and is passionate about speaking up on carer issues and ensuring that carers have a voice and are recognised for the role that they play. Kellie, thanks so much for being part of today's webinar. Keen to hear about your experiences with the Carer Gateway.
Probably during COVID, I think we had a little break in the lockdown period where, after caring for my grandson at home and schools being closed down, stress levels were quite high, trying to balance working from home and homeschooling. And I really wasn't coping, to be honest. I was at the point where I thought, do I discontinue working, or, how do I find this balance? And it was at that point in time where I realized that not only had I transitioned into this space where I was starting to really identify as being a carer, but also that I really needed some help. So I contacted the Carer Gateway, and they're an amazing group of people who then referred me on for some counselling through Carer Gateway, and also helped me to have a bit of a break during that period of time.
It sounds like it was a really, really critical and really involved period of time. Tell me, when you did make that first contact with the Carer Gateway, one of the key experiences that carers go through is that sense of really mapping out goals and looking at what they might like to achieve, or what sort of I suppose experiences they want to have that the Carer Gateway could help facilitate. Where were you? What were you looking to sort of tap into when you first made that contact and connection with the Gateway?
When I first made contact, it was more around wanting to talk to someone and feeling really overwhelmed and not wanting to overburden friends and family with how I was feeling. So I didn't quite know. I knew of the Carer Gateway. I wasn't sure what they could or could not provide in terms of my emotional support at the time. And I wanted to keep it separate from family and friends. So I contacted Carer Gateway, and the girls there were lovely. And what they identified was that emotionally I was really struggling with lockdown and caring for multiple people, that my mental health had started to be affected as a direct result of that. And so they offered to refer me to psychology support. And I was given, I think it was 6 free sessions with a psychologist over the phone that really did help me to move through that very testing time.
Really pleased to hear that. Kellie, you juggle a huge amount caring for your grandson and then also for your parents as well too. It's a significant responsibility. Tell me, how do you go about juggling and balancing all of those responsibilities that you have?
Oh, that's a bit of a loaded question, Evan. I don't know how I do it sometimes, to be honest. But what I do know is that I have a good support network. I know where to go to access support if I need it. I have transitioned back into the workplace, so that's provided me with a good balance, I guess. But just knowing, I guess, that if things do get challenging or if I am needing that support, that I can reach out. And I know for a lot of carers out there, they often don't identify as being a carer and therefore are missing out on accessing really valuable supports. And I think it's, as a carer myself, even sometimes will minimise that role in terms of, well, I'm just a mum, or I'm just a daughter, or I'm just a grandmother, and I'm just doing what I need to do as a family member. And I think quite often the significance of the role that we play in terms of caring for family members can kind of get lost in the chaos sometimes. So
I really, really appreciate those reflections. And just as one final question, Kellie, and thank you immensely for your time and participation in today's webinar. You mentioned that it can be difficult to identify as being a carer. And so I'm wondering whether you have any advice for other individuals or members of the community who are out there that are also in a similar position where they really don't identify with that sense of being a carer, but it's quite clear that they have those caring responsibilities. What advice would you give them in terms of taking first steps to really achieve and receive the sort of support that could actually benefit them a lot?
I think the first step is to actually just honestly get on the phone and contact the Carer Gateway. it's amazing how that initial phone call, and often I've found that when you're talking to people at Carer Gateway have a lived experience themselves, so they get it, they understand the pressures around it, and having someone to talk to that can just unpack where it is that you are and what it is that you need in order to continue to move forward. And that may mean, it may be as simple as just having that conversation. Sometimes that may just be enough, but I think connecting with other carers that understand the pressure that comes from caring for family members, not everybody understands it, not everyone is in that position. And I guess in my experience with the Carer Gateway, it adds a layer of personal value, I guess, to the contribution that we give in terms of looking after other people and being appreciated and acknowledged for that. But definitely, like, get on the phone, because they're really understanding and really supportive.
That's such great advice. Kellie, thank you so much for being part of this webinar and for your insights and reflections and words of encouragement there too. Really, really do appreciate it.
Thank you. Thanks, Evan.
Thank you. This is the webinar, Caring for Carers, COVID and Beyond. It's now my pleasure to introduce the State Manager for the Carer Gateway, Vicki Down. Vicki Down has been working in the carer space for many, many years and provides a wonderful role in terms of offering leadership across the state in ensuring that operations are running smoothly to ensure that carers are getting the support and assistance that they need. She's a really tireless advocate for supporting carers in the community, and particularly passionate about reaching hard to reach carers within the community too. Vicki, it's been quite a year over the last 12 months and it's quite a lot ahead as well too.
Yes, there is. Thanks, Evan, and thank you for the introduction. Hi, everyone. I'd also like to acknowledge the traditional owners of the land on which we all meet today and pay my respects to elders past, present and emerging. It was great to hear firsthand from Kellie today. Carers like Kellie are why we're here and at the heart of everything we do. And we're actually planning to do a lot this year. As Tassia mentioned earlier, this year we will continue to grow the Carer Gateway and increase the number of carers accessing support. Our vision for the year includes scaling up our services, such as our intake service, to improve carers' access to the service and reduce wait times. Our care engagement teams have grown and are planning a range of activities to reach out to the carers, including hard-to-reach carers who do not identify as a carer. We're increasing our marketing, including a mobile office that will travel the state. I'm really excited about that, actually. We are setting up a carer advisory group who will work with us to co-design activities and provide feedback on their experience with the Gateway and to help us improve our services. We will also focus on making the most of local connections across the state, teaming up with more carer support groups and placing a strong emphasis on peer support. I'd like to thank all of our Carer Gateway partners who are here with us today: Alfred Health, Ballarat Health, Barwon Health, Bendigo Health, Family Care and Uniting Victoria and Tasmania, and of course Merri Health, and to the other organisations who have played an important role delivering the Carer Gateway in Victoria, including Carers Victoria, Tandem and Anecto. Without our partners and our other organisations, we wouldn't be here today. I'm delighted to now welcome our panel of local experts to share their lessons learned on the ground over the past 12 months on how we can all best care for carers during COVID and beyond. So I'll just introduce everyone. So we have Melanie Hill from Alfred Health, Rob Gargano from Bendigo Health, Katie Millen from Family Care, Jen Polley from Barwon Health, Nilo Banai from Uniting, and Mick Leyden from Merri Carer Services, and last but not least, Raj from Ballarat Health. So I will ask everyone to join the panel now.
Thanks, Vicki, and also ask all of our panelists to turn on their camera as well too. So all of our lovely attendees are able to see your fantastic faces spread across the state of Victoria. Great that you're here, everyone, and also extend my thanks as well for your hard work on making the Gateway a real success over its first year in operation. And so really mean that quite sincerely. I know how challenging it has been at times to ensure that everything has been in the place that it needs to be to really get the supports where they also need to be targeted. And through your collective endeavours, you've played a really, really special role in ensuring that carers' goals are able to be worked towards, and individuals who wouldn't have had access to the supports to assist them in their caring responsibilities have indeed been able to access them through the Carer Gateway within its first year. One of the big themes of today's discussion, and it's also just on everyone's mind, it's on everyone's consciousness, and I know it's very much still there in our planning and in our coordination of services and support, is how we respond to carers who have and are affected through the COVID-19 pandemic. And so if we think back over the last 12 months, it's involved a whole range of creative responses, as the Minister mentioned, but also at the same time, we've seen, and as we saw over those 12 months, changes in carer needs. And so my first question is for Nilo from Uniting. And Nilo, thinking about the last 12 months, and in particular, looking at the transition from the first to the second lockdown in Victoria, what changes did you see in carer needs?
Thanks, Evan, much appreciated. So we have seen quite a lot of changes within carer needs. A lot of them include needing more time to themselves and requiring supports in the home, as well as transitioning in or out of different various care. So through the Carer Gateway, we've been able to support carers during the pandemic by being flexible where we can and providing different services as well to support the needs of the current situation. So we have seen quite a lot of changes, and we acknowledge that it's been quite a difficult time, but we have also successfully been able to support many during this journey.
Thanks so much, Nilo. I'm curious also to hear about what that's been like from a regional perspective. We have Rob from Bendigo Health. And Rob, before I ask you the same question that I've asked of Nilo, tell me about the area that Bendigo actually supports, because it's quite a big chunk of the state.
It certainly is. I think the Loddon Valley region, which is the region that we represent in terms of Carer Gateway services, is about 26,000 square kilometres. So we cover quite a bit of space. So it is a big region, absolutely.
That's huge. It's really quite significant, and involves a lot of coordination, and sometimes aeroplanes might even have to be involved too. But for you, Rob, thinking about last year, how did you see carer needs change?
So I think, firstly, thank you, and it's great to be here. What a great achievement. But I think a bit like, just to extend on what sort of Nilo touched on, I think those real practical supports have been absolutely crucial for, in terms of supporting carers. So when I sort of talk about practical supports and services, that's things like, delivery of prepared meals, things like transportation to medical appointments, essential medical appointments. And also, I mean, we're seeing, well, a lot of Australians have sort of, financially at a loss given COVID, but for our carers, that's been a real issue. Some of the financial issues around, having to couple employment, not being able to work because their caring role has become more complex, etc. I think they're probably some of the real in-your-face changes that we're seeing carers requiring over the last 12 months or so.
Really, really important insights to share. Thank you, Rob. And I know that the sort of complexity and thinking about those confronting challenges is something which has definitely been on Jen Polley's mind. And Jen's plays a really important role as a coordinator of carer services at Barwon Health, and that stretches along. Is it right, Jen, from Geelong all along Bass Strait and then the Southern Ocean towards Warrnambool?
We cover thanks, Evan. We cover all of Barwon Southwest, which goes from basically Geelong right through to the South Australian border, up through the Southern Grampians area. So it is not as big as the Loddon Valley area by any stretch of the imagination, but it is still quite a stretch of Victoria, and it ranges from quite remote carers to carers that are in Geelong, which is, you know, a very regional town, just a little bit off from Metro. So it's quite a diverse range of carers in that mix.
Yeah, absolutely. Really, really different profiles and different towns and different demographics, but maybe united by the fact that everyone's who you support, or a fair percentage of the cohort of carers that you support have experienced added levels of complexity over the last 12 months. Jen, what have you observed in terms of feedback from the ground and some of those challenges that Rob was talking about, where carers have really had that extra layer of pressure put on them?
I think the biggest thing with COVID that we found was during lockdowns, where people are suddenly, they're not just looking after the person that they care for, but they're looking after their children working from home, or their spouse working from home, or, you know, there were so many more complexities in that space. So as Nilo said, that carers didn't have that same level of time to themselves that they may well have had in the past. They actually really had no time for themselves. You know, they couldn't, in Victoria, which, you know, in Victoria and in Melbourne Metro in particular, you know, they weren't allowed out of their houses hardly. So it was an incredibly difficult time. And thrown into that mix as well were the fact that even workers that could provide supports for carers, they were more limited in the supports they could provide as well. You know, there were job losses there. They had to look after other family members of their own. It was so hard to get workers to actually be able to provide that direct practical support to carers. They weren't going into residential respite in an aged care facility, obviously. So it was a really huge burden that was added to the caring role in 2020.
Thank you so much for sharing that, Jen. And going from the southwest of Victoria and up to Princess, and then when we're not in lockdown, through some very heavy traffic to Melbourne's southern suburbs. Really like to hear from Mel Hill. Mel, tell us a bit about your role and the work that Alfred's doing, and where exactly in Melbourne you're providing support.
Thanks, Evan. So we cover nowhere near as much land space as Rob and Jen, but we cover along the Bayside, really. So we go from the city of Port Phillip all along to the peninsula, and then across to Casey Cadinia and Pakenham kind of areas. For us, it's a big wedge. It's about 10 LGAs, so it's a lot of areas, but in terms of land mass, not quite as big as the others.
But a lot of people and perhaps a bit greater density, just a smidge.
Just a little bit, yeah.
Mel, thinking about our first year of operations, over that time, things have settled down, and at least in the sense of gateway services. So it was all very new for providers and also for carers at the beginning. And so now we're a year and a bit into the journey of providing supports through the gateway. How's this sort of transition in this period of time been for you? What have you seen sort of emerge as sort of trends in the nature of supports that you find yourself delivering?
I think it's been a year of learning for all of us. I keep having to remind ourselves that it's a brand new model in a lot of ways. We've all come from the carer space and have worked in carers for many, many years, but this is a different way of thinking and a different way of engaging carers. And I know one of the things when I was thinking about this webinar and thinking about the last year, one of the things that kept coming to mind was I've had lots of conversations with carers about them having to think about their own needs for the first time, and not just having conversations about the people they care for, and finding it really hard at times to articulate what that need is for them and how do they start to look after themselves. It's been interesting too, having the coaching pilot running during that time, and some amazing stories coming out. And one of the things that I think I've taken from that is carers can't always say something really specific. We've had carers through coaching, for example, that their goal is just to be better. And then the coaches work with them to unpack what does that mean in their life and how do they engage differently. And I think it's been a really interesting journey for us to flick from just thinking about the people that they care for and helping carers unpack what does it mean to look after yourself and focus on yourself. And that's particularly challenging in COVID when all they're doing is caring and not being able to step away. So it's been an interesting time.
Really, really interesting time. And on that, when you are doing that work to better understand carers' needs and working with them, which is such a key part of the gateway to set goals and to really look at the carers' individual needs as opposed and distinct to those of the care recipients, where there is that challenge to really have that differentiation, what's worked well to actually really create a space for those conversations that do highlight and pull out those key goals and hopes and that carers have? What's worked well for you at Alfred?
I think patience is a big one. We've asked carers to switch their thinking in literally a sort of 24-hour period to go from thinking about just the people they care for to thinking more about themselves. And I think that's been a hard transition. So being patient and meeting the carers where they're at, that it might take a couple of conversations to get them to be able to articulate what their actual needs are. I think the other thing that's helped is that we've had to be really creative. We can't just sort of tread the old roads that we've always done. We've had to think about and help maybe introduce ideas to carers in a different way and help them unpack what that might mean in their world and how that might help. So it's been an interesting journey in terms of helping our staff understand how to engage in that way, but also to help carers engage in that way.
Oh, I really appreciate those insights, and I'm assuming that's the same for all of our attendees as well too, who are joining this webinar, Caring for Carers, COVID and Beyond. Driving up Hoddle Street and going from Melbourne South to Melbourne's North, and we find ourselves in the land of Merri Health, and great to have Mick Leyden here. Mick, also keen to find out your insights, looking at the last year of support, what you've really seen emerge as key trends in terms of how the gateway's evolved, or I suppose how Merri's work through the gateway has evolved to really get that tailored assistance to carers where it's needed.
No, thanks, Evan. It's really great to be here today. I think probably there's been a real shift over the course of the 12 months. As everyone has touched on, there's a lot of families and care relationships that were perhaps under pressure and in a precarious position before COVID that were really pushed into crisis during that particularly intense COVID phase last year. And I think at that point, really it was about practical support, just help people to get through the crisis, because at that point, you're not really able to have a conversation with them about what are your long-term goals. The carer in that point is saying, my goal is survive today. So we've sort of been through that phase of let's just deal with the practical things and help you get through as much as we can. And then as we come out of lockdown and sort of into the first half of this year where things have been opening up again, similar to what Mel was saying with the coaching program and some of the peer support options as well, we've been able to have conversations with carers thinking out a more longer term perspective. So, what are you starting to think about? Have you got goals about returning to study? And we've been able to help some carers with that, or finding pathways back to employment, or even just building some stronger social connections through some of our peer support options as well. So I think there's been a real transition, but I think, as Mel said before, one of the real key things is talk to carers where they're at and understand where this family or caring situation is right now. Is it in that crisis point, or are they starting to look at what's beyond, and how can we help them move on that journey so that they get from the crisis and then we can help them to move on to that next phase as well.
And from your vantage point, that must be pretty exciting too, being able to see that shift and see that response, and to be able to go from initial supports, getting that service through the door, to actually really being able to expand the conversation out to longer term thinking. Is that something that you find particularly rewarding, Mick?
Oh, absolutely. I think building a service that is designed to encourage people to think beyond the crisis, I think is incredibly exciting. I think carer services for a long time have been focused on or driven by the crisis point that's driven the phone call. And often services have been set up so that we'll deal with the crisis and then we'll turn to the next person who's rung us up with a crisis, and we don't often have the opportunity to go back. So the capacity to have a broader conversation, using the carer star as a great tool, being able to look at all of the domains in someone's life and say, okay, well, there may be a crisis in this particular one, but actually these other two areas are not going so great either. Maybe we can talk about those after we've dealt with this initial crisis. I think is a really positive thing, and it allows us to hopefully build capacity of carers and help them to have a much better existence than they maybe did previously.
Absolutely brilliant. Really, really appreciate that, Mick. Thank you. We know that the Carer Gateway is one part of the overall service mix and service landscape that's here in Victoria and across Australia, and that big part of the Gateway's success also hinges off being able to coordinate and work with other services within the community too. So going from Melbourne's north and taking a trip up the Hume and then veering off onto the Goulburn Highway, I think, if I'm correct, we land in Shepparton, which is the headquarters for the family care. Katie, Millen, thanks so much for being here as part of the panel. Keen to hear a little bit about where family care is providing support, but also too, how family care teams up with other organisations in the community to ensure that carers are getting the assistance that they need.
Absolutely. Thanks, Evan. So family care, again, we probably cover quite a large area. We've got, I think it's 7 LGAs that we cover. So Greater Shepparton City, Mitchell, Murrindindi, Strathbogie, and we've also picked up Benalla and Mansfield Shires. I guess, as everyone else has sort of said, we have all worked in the carer space for a long time. So a lot of us have already got really strong relationships with other services in the community. And we've really, I guess, worked to strengthen those and to really use, I guess, those other providers to help us to get the message out there to carers about how they can be best supported and how we can all work together to really, I guess, develop a response to their needs that helps them into the future.
That's brilliant. And when that works well, what does that, where does that land? I suppose that's where I'm keen to see and to learn a little bit more about too. So when that coordination works well and that those linkages are positive from a carer's perspective, how does that actually really benefit the carer at the end of the day?
Yeah, I guess, again, as everyone sort of mentioned, we've really in this last 12 months had that ability to really focus on carer needs and specific carer needs, and I guess move a little bit away from just focusing on the needs of the care recipient. But when we can work really well with other providers, it means that carers and the person that they care for get a really rounded support. So we can make sure that the person being cared for is linked into the right services that they need, but then that also allows carers that time to really have, I guess, that focus on themselves and about what they need. I guess, that real shift from, as Mick sort of said, crisis work to that preventative type support.
Thanks, Katie. And then tracking along the Midland Highway, I think will get us there. We end up in Ballarat. Raj, one thing that I really love about your approach is the optimism.
It looks like Evan has frozen. I'm not sure what's going on. So I'll take up the conversation. Raj, how have you found the last 12 months and what do you think some of the issues have been for carers in the Ballarat area?
The last 12 months have been exciting in terms of introducing new services for carers too. But what struck us the most was the selflessness that the carers have demonstrated in that time too, that they're not thinking about themselves, they're just doing more and more for the care recipients, and being able to engage with them in that positive way around shifting their thinking, like others have mentioned too, was quite a big and quite a rewarding thing. And also for our staff too, to be able to engage with carers in that more meaningful way where they can focus on themselves was quite challenging to begin with, but exciting as well. And as we as we understood the Carer Star tool that we use more and more, the more we understood that, the more we were able to work with the carers for them to understand that better and derive more benefit from that understanding they gave to. Personally, I felt that when we have conversations around how you're feeling today, they're very subjective. But what Carer Star does is it gives us an objective score for those subjective feelings. And sometimes that's all you need. So I could be saying, I'm not feeling really good today. I'm a 4. But then I may not be feeling good tomorrow, but I might be a 5 or a 4.5. So there is some improvement in that feeling, which is hard to pinpoint using just subjectivity. So I think that was a refreshing change in being able to, for the carers to be able to say, oh, there's a shift that gives them the encouragement, yeah, I'm on the right track, should keep going and be able to get those services. And also just giving the confidence to the carers was a key that they've got this. We're there for them. We'll always be there for them when they need us, but they have that resilience in themselves to be able to continue doing what they've been doing for such a long time and been doing so well. Just giving them that confidence, it's a great thing. And also being able to tap into the carers, like the hidden carers, as we call them, people who have been doing the caring role and been undertaking that really well, and then not being able to, just them feeling like, oh, I don't want to seek services because then I become dependent on services, changing that shift in that thinking around, like, you're not actually becoming dependent on the services, we're just helping to fill in some of the gaps that will enable
Raj, tell us a little bit more about that in terms of reaching hidden carers. And apologies for dropping out there before. I think with 3/4 of Melbourne working from home right now, the network was a little bit overheated. So Raj, you mentioned that's something that you've really enjoyed, is connecting with those hidden carers. How have you actually gone about in practice making it a friendly and welcoming and easy space for those hidden carers to come into the gateway?
I think a lot of that has to do with just the networks. So carers may not be accessing support for themselves, but they've been accessing support for the care recipients. So being able to tap into those networks and talking to those professionals there, the healthcare professionals or the community services that are already working, being able to then talk to them and making them understand what this is all about, and then leading on to the other carers was helpful. Or forming networks with the community partnerships who are not providing a healthcare service. For example, looking at the schools and going and talking to a young care champion, probably going out and talking to the school health and wellbeing officers and being able to educate them or inform them about the services that are available, and then linking into young carers, or forming stronger links with the Regional Multicultural Council here for them to then be able to spread that word to other carers in that space, or working alongside the Ballarat Health Aboriginal Health team and being able to approach other carers that this is a safe, secure environment where we are sensitive to their needs, but we're there not to take over their lives, but to be there for them when they need us, as and when required.
That's really excellent. Thank you, Raj. I have one last question for all our panelists, and I'm asking for a very brief answer because we're very fast at the end of today's webinar. And that is, what are your greatest hopes for the Carer Gateway in its second year of operation? So greatest hope for the next 12 months. And I might reintroduce Vicki into the conversation here. Vicki, what are your greatest hopes for next year?
Well, I was hoping we'd be out of COVID. So we're back in the same boat we were last year, but I am really hoping that we'll be able to get out there, do some more outreach, meet more carers, promote the Carer Gateway, and just let people know about the service. We've been fortunate during COVID that the Commonwealth has provided us with more flexibility, and that's been fantastic. But it would be great if we could just get out there and do what we're really good at, which is engaging with carers.
Brilliant. Returning to Nilo. Nilo, your hopes for the next 12 months with the Gateway?
We also hope that we can reach more carers and provide the support and the awareness of what the Carer Gateway can provide to carers and the people that they care for. I think it's important for carers to feel that there's services and supports out there for them. So a lot of promotional activities would be fantastic, and that's what we are aiming for.
Fantastic. Thank you, Nilo. And Rob, your hopes for the next 12 months?
Yeah, hopes would be that we we increase access and awareness about the Carer Gateway to our carers across Victoria, and that we continue to work hard and we all stay safe and healthy in order to be able to do that. But I think, yeah, it's about increasing access and awareness to our carers and learning more about what they need.
I think that's really important, being able to reflect on the overall context there too. Jen, your hopes for 2021, what's left of it, and heading into 2022? Gee, that's a scary collection of numbers.
It certainly is. I suppose our hope is fairly similar, like Vicki said, around actually being able to get out physically into the community again. You know, last year we did have to be creative. We did have to do things online, which for a lot of us was probably the first time we'd ever done Zoom or any other type of, using that sort of media to reach people. But it would be so lovely to really be able to get back out in amongst the community to meet carers exactly where they're at. That's really what I'm hoping for in the next few months, as we hopefully do get out of COVID and can move beyond it. And from that, being able to just support carers in the way that they want to be supported, and that's going to help them to build their capacity so they can continue in their caring journeys, and with that knowledge that they have got that support behind them if they need it.
Thank you, Jen. And then for you, Mel, you're of a similar mind that you're hoping to get out and about too, or different set of hopes for the next year?
Obviously very similar. I think it would be great to get out and meet with carers again. I think we had a small window of that opportunity, but I think the two things that I'm really looking forward to, and one I touched on earlier, was around coaching. We've obviously piloted that, and the feedback from carers has been amazing. It'd be great to see it rolled out across the nation, and I'm really keen to see how some of our other partners in the webinar engage with it, particularly across the rural areas. I think it's going to be a great opportunity for carers. And the peer support, I think, has had a bit of a slow start because of the lockdown and the impact of COVID. So it'd be great to get carers together and having them actually speak to other carers. I think it's such a valuable resource. Carers seem to get the most benefit and joy out of talking to other carers who can understand their circumstances. I'm really keen to see both of those things sort of fly in the next 12 months.
Just wonderful. I think that sharing of knowledge and experience is really essential. Mick, for you, next 12 months, what are your hopes?
Look, certainly picking up on what Mel said, peer support I think is just critical for carers. It plays such an important role. But the other one for me is building really strong community partnerships across our region. Similar to what Raj was saying earlier, engaging with schools and other community health organisations and disability providers, and really making sure all of those different organisations know who we are, what we do, what a carer is. And so if a carer is engaging with them, those organisations can identify them and either let the carer know about us or refer the carer directly to us. I think those opportunities to have those really strong partnerships within our community is a great way to catch some of those hidden carers, similar to what Kellie was saying before, the people who don't even realise if they are a carer. So that's something that we're working hard on. I'm really keen to continue with.
Excellent. Thanks, Mick. And then Katie, your hopes with your work with carers through the Gateway in Northern Victoria for the next 12 months?
Yeah, thanks, Evan. Very similar sentiments to what everyone's said. I'm also really excited to be able to roll out the coaching program and the peer support. But I guess probably, at the crux of it, my I guess hope is that really the Carer Gateway just becomes more familiar to carers, to the community more broadly, and that we can just reach as more carers than we've been able to so far.
Wonderful. And Raj, you get the final say.
I think just all of those sentiments, absolutely. The partnerships, the coaching, peer support, they all have a very special place, and we do want to build upon all the work we have done so far. Our particular focus will be on early intervention. We really want to be able to engage with the carers as soon as we can, and that's going to be a key part for us.
Glad to hear it. Really appreciate everyone's hopes and insights. And Also extend huge thanks to everyone who's been part of today's webinar, Caring for Carers. That includes all of the different representatives from across the Gateway in Victoria, also to Tassia, Michaleas, CEO of Merri Health, Vicki Down, the State Manager for the Gateway in Victoria, and of course, Kellie King, who gave us a set of her insights from support received through the Gateway. It's been a real pleasure hearing from you all and being able to learn a bit about what's worked and what have been the challenges over this period of time, and also what's ahead too. As I mentioned at the start of today's webinar, we've made a recording of this. So if you'd like to be able to share this with friends, colleagues, carers in the community who didn't get the chance to be able to tune in today, it will be made available. That's all from me. It's been a real thrill. I'm Evan Wallace, and this has been the Carer Gateway over the last year, and we'll catch you next time at the next event.